A report on dementia sufferers and their carers has exposed problems with every aspect of care.
The Alzheimer's Australia report finds problems with diagnosis, confusing and inflexible care packages, inadequate training and pay for aged care staff and the lack of respite for carers. Mark Butler is the Federal Minister for Mental Health and Ageing and he joins us now from Adelaide. Minister, good morning.
Morning, Michael.
This report, most Australians would agree, highlights a pretty disgraceful set of affairs for those with Alzheimer's and those caring for them. How has it got so bad?
Well, the report makes for very sober reading, and I attended a number of the forums that gave rise to the report around the country, and frankly they were very powerful stories coming out of families of people living with dementia. It confirms that our aged care system really is struggling to meet the needs of older Australians today and will be pretty incapable of meeting the needs of a very fast-growing group of older Australians into the future, particularly as the large baby boomer generation retires. And that's why aged care reform is such an important task for this government.
What was the aspect of the report that struck you the most, looking at all of the experiences faced by those with dementia and those looking after them?
Well, most of our discussions around aged care reform have focused very much on the aged care system, but the report from Alzheimer's Australia confirms that families with dementia are let down right through the health system. They take too long to get a proper diagnosis from their frontline GPs, on average more than 3 years between the onset of symptoms of Alzheimer's and a proper diagnosis, which means 3 years are lost in terms of making arrangements for your family. Also, dementia sufferers in hospitals find that if they're not properly identified as having dementia, then they again find it very hard to interact with hospital staff. Within the aged care system, there aren't enough proper supports in place for the particular needs of the growing number of people with dementia and their families. So it really is a challenge for us across the health and the aged care system.
You've highlighted the problems there, Minister, pretty starkly. What is the Gillard government going to do about them?
Well, we asked Alzheimer's Australia to conduct this series of forums to inform us at a more personal level, if you like, about the challenge of aged care reform. The Prime Minister and I released a very important report some months ago from the Productivity Commission, and since then I've engaged very closely with aged care stakeholders, the provider groups, consumer groups like Alzheimer's Australia, aged care unions and such like, to go through those recommendations very deeply and very closely to work out what our response should be. I thought it was important though that we also hear directly from older Australians, which is why I attended forums with over 4,000 older Australians over recent months to hear from them directly, their experiences, but perhaps more importantly, their expectations of the aged care system in the future. And they've been very valuable insights for us to develop our response, which we're doing as soon as possible, to the Productivity Commission report. Well,
you're right. Well, consultation's a fantastic thing, but now the rubber does hit the road. Alzheimer's Australia says a $500 million package from the federal government will help alleviate some of this pressure faced by dementia sufferers. Will they get that?
Well, the ball is in our court. The ball is in our court. I've done all the talking that I need to do. I've met with all of the stakeholders. I have a very good understanding, I think, now of their priorities and what they think of the Productivity Commission's recommendations, and I accept the ball is now in our court and we need to develop our response and release it as soon as we possibly can.
They want a pretty urgent response. Will they get the $500 million?
Well, I can't speculate on dollar amounts. This is one piece of work done in the aged care space. There are lots of other elements of the Productivity Commission's report which are the subject of submissions by other groups as well. So I can't comment on particular dollar amounts, but we've taken the views of Alzheimer's Australia right throughout this process very, very seriously. Dementia, Alzheimer's in particular, is a very serious growing challenge in our community. Over 300,000 Australians currently live with it. And we expect that that number will double every 20 years if we don't make some very quick inroads into our understanding of the disease.
Well, you're, like every aged care minister, would like in an ideal world more money to be thrown at the system, but are you frustrated that your hands are tied by the government's move to get the budget back into surplus, making the spending packages almost impossible?
Well, no, I'm not frustrated. The Prime Minister indicated in the lead up to the last election that aged care reform would be a priority for this term of government, and we're standing by that commitment. We take these recommendations and reports like the report that we're releasing today very, very seriously. But I think the message from Alzheimer's Australia and other groups in the aged care sector is that throwing more money at the existing system won't be enough.
It'd certainly help a lot.
More money always helps portfolio areas like aged care, but throwing money is simply not enough. That's been the very clear message. The aged care system we currently work with is about 25 years old. It's not set up to meet the needs and the changing preferences of older Australians. So it's not just a question of money, it's also a question of how the system is constructed, and that's why this reform piece of work is so complex and why it's so important.
And just quickly before you go, Minister, on the broader aged care industry, which you described as an industry in crisis over the weekend, there's growing concern amongst a lot of older people that they may have to sell their homes to pay for often very steep accommodation bonds to get into aged care services. How significant a problem is that, and how is the government moving to address it?
Well, almost 40% of aged care residents have had to pay a bond to get into their place. The bond on average is about $264,000 now, but the Productivity Commission heard of bonds often in excess of $1 million, and I think the highest bond they came across was $2.6 million paid to get access to an aged care place. Now, obviously, providers receiving bonds like that are getting a stream of income far in excess of the value of the accommodation they're providing. And also, obviously, particularly given that people tend to enter residential care in their 80s, people are having to conduct a fire sale of their home to find these sums of money. So this is a very important part of the reform puzzle. People are distressed at having to make those sales, often at a time of emergency. Mum, for example, has been hospitalised after a fall. She's been fined for ages, but now needs to go into an aged care facility. Families that are confronted with the need to sell a home in those circumstances of crisis, are complaining about that process and are complaining about the apparent lack of a relationship between the size of the bond and the value of the accommodation that they're receiving in return. So this is something that we're looking at very closely in the reform jigsaw puzzle, if you like, Michael.
OK, Mark Butler in Adelaide, thank you very much for your time this morning.
Thanks, Michael.